So COVID-19 is spread through what we call droplet transmission. So droplets are larger particles, so still microscopic, but relatively larger particles that are generated through coughing, sneezing, and to a lesser degree talking. And so this is where social distancing really comes in, because those particles only travel a relatively short distance, so perhaps a metre and a metre and a half. So if we do our best to stay at least that distance away from each other, we greatly reduce the chance of transmission. Also, these droplets can land on surfaces and then be picked up through contact. So again, if we do our hand hygiene really well, we're going to reduce that avenue of transmission as well. So given this virus is spread through droplets, we think those droplets can potentially survive on surfaces maybe up to around 3 days, but it's important to point out that the virus numbers do reduce over time, so the highest risk is possibly in the first day. But again, if we adhere to our hand hygiene messaging, as well as some things around cough etiquette, for example, so that those particles are mostly going into our hands and then we wash our hands, we'll reduce the number of particles on surfaces. And if we wash our hands after we touch things, before we touch our face or eat, for example, we're going to reduce that chance of picking them up that way as well. So given COVID is transmitted via droplet transmission, it's important to know the difference between that and something that might be airborne transmitted, for example. And the main difference there, I guess, is through things like air conditioning. We can't transmit droplets. So air conditioning is not a way people will get COVID-19. It really is droplets. So that's where we need to be in fairly close proximity for a significant amount of time. So that's why social distancing is really important. And again, staying away from work if you're unwell. So I think it's clear this situation is evolving very rapidly, and we need to do all we can to protect our patients as well as our staff. So it makes sense to have fewer people coming in so that we reduce the risk of introducing this virus into our hospital as much as possible. It's also around the proper use of PPE and alcohol-based hand rub and other consumables that we need to preserve during this difficult time. At the Mater, as we are more broadly, we're always looking at ways to help to curb the transmission of this infection, and one of those is around gatherings of multiple people. Obviously there's been some recommendations in the community more broadly about larger gatherings, but it's a body of work we're also looking at here at the Mater. At the moment there's no mandate to cancel all meetings, but I'd recommend people reprioritise meetings and look at alternative ways of getting information out to groups, such as electronically or video conferencing if at all possible. And if a meeting is to be held because it's clinically important, for example, that we adhere to the messages around social distancing, so to try and stay at least 1.5 meters away. Obviously make sure we're rigorous with our hand hygiene upon entering and leaving any gatherings such as that. And I can't stress enough, if someone's unwell, definitely don't come to work at all, but particularly don't come to any meetings where other people might be present. We're currently getting a lot of questions around staff who perceive they may be particularly vulnerable to this, and I'd like to reassure everyone we're doing a large body of work to protect not only vulnerable staff but all staff at all times. And our measures that we've implemented around social distancing, hand hygiene and the proper use of PPE, I can reassure everybody, are designed to protect all staff irrespective of immune status or other perceived susceptibilities such as pregnancy. So yeah, all staff are being protected at all times.